One major reason for choosing OHSU is I went to prosthodontic residency before this, and in looking to dual specialize, I wanted a program that could fulfill some of my needs for what I wanted to continue my training. Part of that is nasoalveolar molding, which we get great experience in as part of the craniofacial team up at Doran-Becker Children's Hospital. Additionally, it was important to have a well-rounded experience with working with the orthodontic colleagues, working with our endodontic colleagues, kind of getting a nice approach of handling pediatric dentistry as a whole, rather than just like a segmented view of just a few things.
So the program at OHSU is a really fun program because we are integrated with all of our friends, both in the School of Dentistry and in the hospital at Doran-Becker Children's Hospital. So our residents get a very nice experience working with both our dental specialty colleagues as well as the different medical colleagues in the hospital programs.
Most of the patients in the whole state that have disabilities come to this one dental clinic because no one else, the dentists aren't prepared to see them and aren't comfortable seeing them. So you'll leave here with really, really good training and be comfortable seeing these kids and know where to look for the answers and that kind of thing.
The residents have a lot of opportunities to just get in there and do pediatric dentistry in the operating room setting, in the clinic setting, the collaborative work with other services and other providers, building confidence and being able to communicate with different medical providers and different team members, and learning how to communicate is such a great component to this program.
We're looking for residents that are self-starters and are really looking to work hard and learn a lot during these 2 years here. I think you're presented with such a great opportunity of being around people that are experts in all of their fields, and so we're looking for people who really embrace that and take that to heart and can give all of their energy and time to really get the best experience out of this 2 years.
We have 4 residents in the second year class and 4 residents in the first year class. So we have 8 residents total. And so we also run 3 different clinics. We have a clinic here at the school, we have a clinic up at the hospital, and then we have our operating room. And so it's something where among the residents, we can be dispersed in any of the clinics at any given time. One amazing part of this program is a second year is always paired with the first year. And that's a great thing because you get to learn from the second year, you get to work with them, and it's something as a first year, whether you're coming out of dental school, whether you've been out in private practice, whether you've done a GPR, AGD, it's nice because you can work with the second year and kind of build off of their experiences.
I can't say enough about how much I love my co-residents, which to me was kind of a surprise because I didn't meet any of my co-residents on interview day. So when I found out who my co-residents were, I was curious what our dynamic would be like, but my co-residents are such good people. They're just genuine and awesome and honest, and we all have each other's back, and we just get along super well.
I love the attendings who are here. We have a diverse group of attendings. The 3 full-time attendings are wonderful. We work with them in the operating room. We work with them in clinics. We can really bounce ideas or treatment plans off of them. Or if we're working with a medically complex patient up at the hospital, that's a time that we can sit down with them, discuss the case, discuss any consultations we need with medical colleagues. All in all, they're amazing.
The faculty here are really great. We have 3 faculty that we work with very consistently. They come with very different experiences and very different treatment approaches that really encourage us to think through why the patient is before us, not just to treat the symptom of their caries process, but also to treat the patient and to address the fact that there needs to be changes, and how to communicate that with both the child and the parents or the guardians.
Our attendings are great. They're incredibly welcoming and respectful, and understand that we all come from different backgrounds. So it's truly a gift to be able to work alongside with people that I look up to, that can encourage our training and encourage our learning.
Portland, it's just it's an active city. There are always people biking. Even when it's a downpour of rain, there are still people out biking, and they just have their rain gear and they're ready to go. It's interesting and funny and cool. Also, it's not that far to get to the coast of Oregon. There are some really beautiful parts parts of the coast of Oregon and just driving through Oregon. The terrain is unlike any I've experienced before.
I've been loving it, and Portland is such a cute town. You go to different areas of Portland and each place kind of has a different vibe to it, but also overall they're cohesively relaxed and everyone is super chill, and I've been enjoying that a lot. The nature is beautiful, like just driving from one place to another, like I'm just amazed by the scenery. So every time I'm driving, I'm just like, oh my God, super distracted by all the pretty trees and the sunset and things like that. So yeah, I love Portland.